You're gonna want to do, I drape a little bit, I guess, different than some instructors do. So I'm just gonna go ahead and anchor this right side, even though we're not treating over here. So that we're gonna pretend Banks is got some mass up here. So this will hold that in place for you. And then you think I do? not the kind of mass we're talking about. Then you're gonna pull just a little bit tight, just to make sure everything stays good. One thing I will say to watch out for, don't have this creeping up onto their neck. Especially if you have clients in the instance that maybe they've been abused in the past, that will potentially cause a trigger on the table too. So keep that down right about clavicle level, top of the manubrium, the sternum. And then to make sure nothing happens, I will pull this tight. First things first, get this bottom sheet taut, okay? So pin that with your leg so that it doesn't move around on you. Then fold underneath to make sure that you can see the coracoid process, the clavicle, and some portion of the pec. Then with this, you will hold here, and let's say it's over on this level. So at that point, you're gonna curl down and roll under and pin that on the upper arm to hold everything in place. Expose the lower portion of the arm. Your bottom hand will take control of the pinning. Then you can mobilize and move the shoulder around as you scoop that tissue underneath and tuck all the way down to the glutes. The reason I do that is because you have an entire anchor all the way down. Then you don't have to worry about anything being exposed at all. You've got full mobility with the arm and everything. Now, to get started, we are going to look at the MFR. So we're going to do the MFR for the whole thing instead of just the bicep and then come down and do brachioradialis. If you're doing an arm in a real world setting, you're going to have to do all of this anyway if you're planning on doing MFR to both places. So beginning in MFR treatment with slow, begin treatment with slow MFR using skin stretching and rolling. Just like the triceps, when we roll, we're going cross fiber because it's really difficult to roll superior to inferior. And some clients, you might not be able to get that to happen at all. And then we will do the same thing as we work down the arm too. So we're gonna go cross fiber on all of this stuff. It's also a really hard place to get any type of superior roll. But for your stretching positions, what I'm gonna say to do is you can either start at the wrist or start up here. It really does not matter. So for these, again, this is an area where I do like to think as much as I can open my chest up, I'm gonna do that when I treat. So we're gonna start proximal to the wrist. I'm gonna traction down towards the wrist first, and then with my other hand, I'm gonna pinch my scapula together to apply tension on that skin. And then you would hold all of these for a minute, just like you have been doing. Now, we've got the thumb in relatively neutral. He's still pronated a little bit. So if you want to just target brachioradialis, get it in neutral, put the thumb position up, and then you would stretch here. You can stretch up in the middle portion, but the area you really want to make sure you don't forget, especially since we're hitting the bicep today, is over top of the elbow crease, okay? Because this will also get the lateral epicondyle. And there are multiple ways to do this. If this isn't working for you, you can stagger. I need you to slide back a little bit, Elliot. You can stagger your stance, track one arm up, and then traction down with the other. The lunge will help you get your power. Works all the same. You can do this all the way up if you prefer, okay? So find 3 comfortable positions. 1, 2, 3. So we got insertion, middle, origin, and then the same thing on the way up. Now, for the bicep, one thing that I will do that is pretty easy is you can just abduct just a touch. Make sure that hand and forearm is supinated. Flex the elbow, take it to tension, and then extend the elbow, and that will stretch it for you. You can do that a couple different ways. Either arm, whichever one works best for you, but you can do that. You can also just hold this arm and stretch up if that's tender for your client. One thing you're not gonna wanna do is take your thumb and press right on that median now down here, so be up a little bit on that arm.
Be something that would be like PNF stretching would be good for?
It's gonna be a little bit more difficult to PNF stretch on the bicep. We will use contract relax to treat brachioradialis, or brachialis and the biceps, but PNFing here, you gotta think, okay, well, you have to have shoulder extension to really lengthen this quite a bit, because it's gotta go, behind the arm and back. So on the table, that's just tough.
Yeah.
So I don't worry about stretching the biceps per se. And when we get up here, we're gonna be stretching all the pecs and stuff too. But again,
Can you hand me that? There's no water behind Ryan.
you look like you're about to cry.
Show me your mask. Sad. Yeah, I'm just gonna take a quick sip here. Bear with me, folks. Getting old.
Can't do it, Max.
Does anyone have a straw?
I love that this is in the
Part of the
video
technique,
too.
right? Is this in the page?
It's in the page.
Good, good.
Hydrate on the table.
Hydrate on the table. Step 4.
Never forget. All right. Now,
There you go.
are you good? You gonna check with that?
Are you good?
I'm fine. Now, so continue your stretches.
I'm gonna tuck it back in here.
So find, 1 position, 2 position, 3 position. Now when you get up here, you can tackle this portion a couple of different ways, okay? You can traction the arm towards you, which will apply tension on all the muscles and the joint itself, and then cup over the anterior deltoid and stretch towards the clavicle. Yeah, this can be pretty intense. That's the other thing I would say. You're not going to have to stretch very hard on a lot of your clients because this is all tender. Now the other way you can do this is you can go the opposite direction and place a hand over top of the deltoid, traction inferiorly, and just make sure you get that skin to grip as you lengthen and lunge forward. That would be another way to stretch, and you're going to get a lot of this depending on hand position. And then we'll cover this one in the pec day, but you can do it too because we got to get to the coracoid process right here. So, and in doing that, if there's a lot of tissue here, I'll either use a closed fist, open palm, or a closed palm like this. But if not, then you can kind of just scoop straight and pull. And we know we've got some scar tissue in here from, what did you said, bicep brachii? Okay. Upper tendon, I fully assume. Or was it a lower?
I think it was like the muscle.
Hmm?
I think the muscle. It was like 11 years ago.
Oh, so it's a little bit lower down.
Yeah.
Okay, cool. But anyway, so a couple ways you can go about that. But honestly, I prefer the traction with the stretch towards, just because
It feels good.
it works ergonomically. You're also making sure that as you traction, no tissue falls out while you hold these stretches. But so today you're going to end up doing about at least 6 to 7 minutes of stretching alone, okay? Because we're doing the whole thing. Now, after you've stretched, you can start high or low. Honestly, I would start proximal to the elbow, depending on which muscle you're starting at. Either way, like if you're going down and working brachioradialis, I would start proximal to the elbow. I would start proximal here just until you get the feel for it, and then you can start wherever you want to. But this makes more sense because we are lengthening this in both directions, so it will help with that extension. So I'm going to start right over top of brachioradialis, and what I would do, just because we'll pretend that we're going to work into the extensors as you would with MFR, find the ulna, so you can feel that there. That is where your starting position is going to be. Pinch and roll. And then just go ahead for practice and roll all the way across through to that medial portion. And what will end up happening is their arm will kind of rock through pronation and supination as you go down that line. You can even pronate if you're having trouble getting to the ulna. Pinch, roll, lift that skin away from the muscle. Being sure to be gentle in all of the tender areas, like the medial portion. But you also want to make sure you're going all the way back to that ulna too, because we don't want to leave any part, left untouched. So you roll all the way down, and then you can roll all the way back up. If you really want to think about flow, start with brachioradialis, go down and up, go up the biceps and down, and you always finish at the elbow. Okay? So, and I usually am going to stop like an inch or two above the actual elbow, or not the elbow, good grief, the wrist, just because a lot of that is all tendon and relatively loose most of the time too. And you're not going to affect all that much for the musculature up down there. Roll your way all the way back up to the elbow. Now with the bicep, not everyone is going to tolerate skin rolling to the bicep. So kind of like the tricep. So you want to make sure you got yourself just abducted enough to access this. We're going to pinch right here. We have the actual humeral head, and so that's where I'm going to start. And very slow, oh boy, very slowly. Remember, you got to do the little wiggles to undo those folds. Go all the way across. Intensity-wise, you doing okay? Okay. And then you are going to stop, like we did with the triceps, at that medial line right here in the middle, where you would go over top of all that neurovascular bundle running down. Lift and roll. Do that all the way up. And because we did not cover the anterior deltoid on the deltoid day, because we're going to hit it in literally like 2 other days outside of this, I believe, we are just going to continue up the anterior deltoid. So we're still on biceps here. And this is where I'll kind of let the roll go. Once you get up into the axilla area, this is super tender. So I'm not going to focus too much on rolling that. Slide on up. Roll that anterior deltoid fascia. There we go. And again, this is one where you're going to kind of let the muscles make your direction for you. So it'll be kind of like a half moon all the way around as you go up. And roll around. And I'm going to stop kind of right over top of the pec and the coracoid process. Because when we do pec day, we're not going to do any skin rolling on the pecs. We're just going to be doubling down on stretches.
On time.
Huh?
On the time of the stretch.
Yeah, well that and how, we'll do them multiple different times too. So you'll do like 6 stretches, but it'll be doubles. 3 stretches, excuse me, but you'll do it twice. And then you'll roll your way all the way back down. And you can see once you start tossing some speed in there, so long as they can take it and they're not laying there crying, needing water, then you're doing all right. One thing I will highlight, just to make sure everyone gets it, is the stretches over top of the elbow. So you can do it cross fiber as well, or a cross arm as well, where you're thinking about your arms like a jack. Let your knees go, push your arms apart, or you can do like we did earlier in either direction. But just make sure you don't skip that one, because we've got all this aponeurotic tissue through here that we want to loosen up too. Now, so using an open palm, we're going to begin with deep effleurage, working from the elbow crease to the attachments at the shoulder. So actually, let's start with brachioradialis, and then we'll go up into this. So looking down at brachioradialis, using a firm open palm, we're going to be basically deep stripping this muscle through here. Now, like I said, if you're having trouble identifying it, put them in neutral, put the thumb up, and then I'm just going to have you perform a little bit of elbow flexion just to meet my resistance. And as you watch, this muscle will load, and you can see the line right here for brachioradialis. You can pinch and isolate that all the way down. You can even see Banks' extensors right underneath and where that line stops, and then relax. That is all brachioradialis if you're lifting up. Now, if you're pinching in towards the radius, you're going to be getting underneath into all of your extensors. So, pinching up, this is what we're targeting. This line right here, all the way down as it narrows. Now we're at the musculotendinous junction, so this is where the muscle becomes tendon. And then now it's just a tiny itty bitty little line down on that styloid process right there of the radius. So that's what we're looking at. Cross and down. So we're gonna apply some lotion now. Banks, I'm gonna have you pull your hair bands off so I don't get lotion on them. You need help, man? There we go. All right, so I'm just gonna apply just that first. Elliot, you might want to come on my right side over here. Now, we're gonna begin deep stripping. Your thenar eminence is your best bud on this. And as you approach proximal here to the elbow, you are going to need to lighten your pressure gently pass across, and then you can shift your thenar eminence into pronation into that humeral shaft there, so you make sure you hit all of the brachioradialis, okay? Go all the way up, and you can stabilize with the opposite hand, pressure-wise, a little more or less, so you're comfortable where you're at.
Take a little more.
Okay. And you're kind of riding the radius here as you go up. And then you can shift hands if you need to your outside hand. Really, whatever feels most comfortable for you. You can also stand to do this if you prefer, which gives you quite a bit more pressure. You gently lean down, but making sure you lighten up as you cross that elbow crease. Okay. So once you've done all of your opening deep stripping effleurage passes, then you can shift into your pinpointed step number 3. It's using a single thumb, stacked fingers. There are going to be some people, such as myself, they can take a fist and you just ride that line. And then again, as you get proximal to the elbow, gently start decreasing your pressure to cross that line and finish with connection. Single thumb or double thumbs would look like so. You can even walk on these if you're really feeling like you have quite a bit of tension in there and you just need to take it slow.
Tom Bish.
Say again?
Oh, is your playlist?
Yeah. And then the other tool that you can use is the actual radius itself. So you can pin brachioradialis into that, which is what you've seen me do, but if you're doing spot treatments, you can pin it in and hold it to basically pinch or compress with just a static trigger point compression into that bone. Because thankfully, these are not super, super sensitive as far as bones are concerned. Like you can work over top of them and use them to your advantage.
But you wouldn't want to pin it against the bone and like walk up.
Well, we technically are, but that's where I'm applying direct compression for the trigger point release. Because, even as we pass all of these, you're still using that to push it into the radius because you're not like going straight to the table. And then isolating trigger points using either pinch or compression, or like we just did, you can stack your thumbs, use that radius. We even got twitch right off of that just from initial compression. To do pincher compression, you're going to make sure that we don't have excess lotion on here, but as you squeeze in, you'll bring your client to mild discomfort, hold, and then what you would do is cross fiber with your fingers to friction that as you come out. And whenever I'm doing pincher compression through here, I'm always going to hit those spots with some petrissage after.
And you're being careful with the median nerve, right?
Yeah. That's a little bit more when we get up here or when you're closer proximal here to the actual elbow itself. But you can pinch or compress, hook under, and lift that tissue away. Just all really depends on what that client's tissue is letting you do. So those are your pinch or compression techniques. Friction, gently come out, hit them with petrissage to make nice before you continue on. Okay? Then looking at number 5. So you would do this to the entire muscle, find a stop and treat all the spots. Now 5, friction at the attachment site. At the humerus, you gotta be careful. So make sure that you're gentle, because if you as you cross the lateral epicondyle. So what I'll usually do is I'll actually just rest my client's hand or forearm on me so that I can control this. You can flex, compress, and extend. That will do your friction motion for you. Or if you want, you can just compress in with your thumbs and friction. And again, that's going to be really slow, really controlled, and direct and flat palpation, coupling in with that extension as you work that supracondylar ridge. You can also use this technique just to strip if you're noticing that they've got some really intense muscle tension up around this area. Just gently working that between flexion and extension. Goes a long way.
On the stretch, or you just like gravity do the stretch?
Yeah, I'm just letting this go down. I'm controlling the pace with my left arm while applying the compression with the exterior. You can do it with both, whatever works for your body, okay? But again, like I said, you can also just do direct compression and friction if you need to. Then we're going to close out this portion with open palm, slow effleurage, making sure to avoid compressing too hard onto the radius. So if they're sensitive through there, you just don't want to crank, but like I said, you can really use that as your own tool to use it as a treatment technique if you prefer, and if the clients can tolerate it. So then open palm, we're just going to do 3 passes, just kind of make nice with all this stuff. And then we're going to shift on up into the biceps. So for this, you can really kind of have fun with this, guys. You can do a lot of support techniques as you bring your arm out to work. You can do some flexion extension techniques. But the big thing you want to do is abduct the arm a little bit so that you have access to the entire medial portion through here, okay? Because if not, this is what I was talking about earlier. This happens all the time with massage therapists. They'll treat this long head, and then they'll get to here, and then they won't continue to go in and pull that bicep back out to treat us. So to break that, just bring the arm out a little bit. Keep it in a pretty neutral position, and then I'm gonna apply a little bit more lotion than we normally would with NMT, because like we said, these tissues are pretty tender sometimes. Make sure you focus on the lateral portion for the long head, as well as shifting to your inside hand. So make sure that you get all of that short head. And I like to kind of cup around the deltoid as we work this. And again, you can do this sitting or standing. Okay, let that muscle make the lines for you though. Once you've performed 3 to 6 passes on each individual head, then you're gonna shift into your pinpointed compression. You can also go the opposite direction, which I think I mentioned in number 3. Yeah, number 3. So we're not gonna do that quite yet. I'm gonna wait until the actual compression or the actual deep stripping. So we know that this bicep comes down through here. All of this is bicipital aponeurosis as it attaches to the radius. So you can start below the elbow if you want, or you can start above the elbow. It's really up to you. But when I'm treating the inside, I'm probably gonna be just using my outside hand. You okay back there?
Yeah, just.
Kevin just made a
Okay.
mess.
Yeah.
So you can see, good for Kevin made a mess with his spine. You're not a mom. So as you strip these lines, we're gonna go all the way up. Oops. We're gonna go all the way up. Make sure, if you guys caught that, I just flipped off of that head there, so you wanna make sure you control it. Sink in, so you'll need to pronate, and then now we're gonna be approaching the anterior deltoid right here. So, you gotta slow down, because we're gonna need to compress into that. And this is basically a bicep and an anterior deltoid treatment.
And that's where the scar tissue is.
He said it was actually a little bit lower. I don't see any surgical incisions or cuts lower.
Okay.
But
They're in
I
my
can
shoulder,
definitely
but
see
there's one
some.
right there.
Oh, turning.
Yeah. Right above my armpit.
There. What are you talking about?
Yeah.
Lord.
Right here.
Yeah. Because that's where I was seeing yours. But, sorry. But, again, once you get up here to the deltoid, you got to go slow, because we know that those bicipital tendons are underneath, and you can feel them. If you can't, you need to stop and perform some slow cross fiber friction, because right there's the long, or excuse me, the short. I can feel it. And then as I move laterally, this is deltoid, and then right here, shoop, that was the long head.
That's awesome.
Okay? So very slowly, just
You saw it,
be
like, pop out
patient.
there too.
Yeah,
That's-
and then just
Oh,
work
wow.
all the way. And I'll do cross fiber friction as I inch my way to that coracoid process right there. And you're gonna lighten up on it. Kind of do a little circle around it, just let it know that you know that it's there. And then just repeat. Okay, so you go up your lines, each individual head, coracoid process. The middle, like we did with the triceps, you can do this a couple of different ways if you want. You can rest your arm here, use both thumbs, and gently inch your way up to separate these two from one another. You can pull away from one another, kind of pry them apart. And now if you have breast tissue your own that you don't want your client's arm resting on, then what you can do is instead take your knuckle or your fist, gently compress into that, and slowly allow it to extend. I'm actually gonna need to take this spot right here. I'm gonna do this mass on it. Like so. And then alternate that between pronation and supination just to coax it apart. And you can see now the long head is over here on my pinky and index, or my pinky and middle ring, and then short head is over by my index and my middle finger. As you approach the portion of the deltoid, you're going to really slow down. Friction, friction, friction as you inch your way on up, and then I'm just going to lighten up, switch to open palm, pull back down. So that's another way you can do it. Then from there, so we treated the short, the immediate center, which that's really separating nicely now. Now we're gonna hit the long head. So, and you can do this exact this technique that I'm using right now throughout the whole thing if you really prefer. So you can scoop underneath, pin that in, compress till there's no tension on it, sink in to mild, and allow that to extend. And then you can do that as you inch your way up.
Okay, cool. Answer my question.
All the way up through there until you cross the deltoid again. And then now we know that as it enters through here to that supraclavicular and tubercle, it's going to be kind of right in the middle. So very slowly, see a fire in there. And actually, I'm just going to hang out right there. And slowly friction, both linear and cross fiber. If you're going to do cross fiber, just make sure you go very, very controlled. And then I'm going to lighten up. Do that line there. Okay, so that's all the deep stripping. Now, a couple things you can do when it comes to trigger point treatment. You can isolate, compress at minimal tension on there, so you could bring it up into close to 90 or just below 90 degrees of flexion. Let me know when you get to about mild. Right there. And then friction by gently extending and flexing about an inch or two each way from your initial start point. So here's my start point, about an inch or two that way. I'm feeling this whole thing is firing underneath me. Right to about middle, right about there. And that will friction that trigger point. You can also alternate to do cross fiber the same exact way. And then if you're gonna do these, especially with the contract relax one, or not the contract relax, the shortened stake, where you're doing the passive movement, you are gonna take about twice as much time to exit this trigger point as you would a regular one. So you're gonna see this is gonna take a little bit of time, and I'm gonna keep on moving it. I'm not just gonna stop moving it. I'm gonna continue to decrease pressure as we move that structure. And then to where it's basically just skin on skin, pull your hand out, do a nice open palm, and then continue about your way. Find the rest of the ones that you want to treat. You can also perform number 5. It says we've got static pincer compression. So we're going to identify the bellies of brachialis now and perform contract relax exercise to mild discomfort to any detectable trigger points. Now the cool thing, if you get this loosened up enough, you can flex, compress in. His bicep is now not on that brachialis because I'm underneath. I can actually feel my 2 fingers touching underneath the bicep with the muscles right there. Okay? So you can get that loosened up enough to where you can scoop underneath, but you just got to be sure to be careful over here. So you can perform a pincer compression on the bicep, compress, and extend down really slow.
What if somebody has a huge bicep? You know,
Yeah, like a Kevin bicep.
Then you either got to have big hands, or you're gonna have to pretty much just skip pincer compression, or if you want,
Take him off your table.
you can scoop and come in from opposite directions like so. But you're gonna need to have some support over here on this side somehow. But then continuing, so that's the top layer. Okay, so that's what it looks like when you pull your bicep up off the arm. And you can do that up pretty high until you get to right about where that deltoid comes across, and then same thing. Okay, so practice with this, play with this, figure out what works good for your body and what feels good to your clients on the table.
Resting your hand here is not good as a female.
Yeah, I mean, if you've got breast tissue, you're obviously not going to do that. That's why I said you're going to need
Because
some
it
other
looks
support
so
mechanism.
comfortable for you to
It
do
is.
that.
It is.
But-
I know, that's what I was like.
Ryan,
Right, Unfortunately, it does feel really like
Yeah.
comforting and good. But the other thing you could do is you could rest it right here
That's what I was going to
on your lateral
the
shoulder. You know, so like if you don't want to just let it rest in your elbow crease, just stick it right there on that lateral shoulder, and then you can come in and pinch or compress that way too. For brachialis now, underneath, so we got that top layer, palpate and feel, and then just push it out of the way. So there's bicep. Boop. So now you can move that all the way out of the way. And I'm gonna come over here. Now that this is moved, I'm gonna hold the bicep here to perform the pincer compression of brachialis. So I'm gonna go underneath. Now, there we go. The thing I'm gonna stop for first is I'm gonna feel for a pulse, which I feel right here. Okay, I can feel it underneath my fingers. So I'm gonna need to go more lateral and more superficial. So lateral, more superficial. Close your eyes, hang out. I don't feel the pulse now, so we're safe to squeeze. And now we're gonna come in, and what you can have your clients do. So if you want to isolate brachialis, we know it just performs elbow flexion, right? So we need to take as much tension off of the biceps to start to be 100% certain. So I'm gonna have you actually supinate your hand. So now biceps are short, now just relax in that position, and then barely perform a little bit of elbow flexion. And you'll feel it push up against your fingers, and then relax. And then have them do that a couple times, just sub-maximal contractions where you can feel, okay, there it is, and relax, now you've got it. Slowly pinching in. Sorry, Banks, my fingernails are like right on that. If I cut them, I'm gonna hate my life tomorrow, stage shift, sorry. And then we're gonna squeeze in, let me know when you get to about mild. Right there. And then you're just gonna hold these contractions, and I'm gonna do opposing directions with my finger. So I'm doing the kind of give me the money to friction, okay? And then the nice thing you can do is then you can deviate laterally and medially and move this muscle in a way that it normally cannot perform. And then you gently are gonna slowly exit out of that, and I'm gonna perform some nice petrissage, being really light on that medial portion, because it still feels good to have this stuff touched. It just doesn't feel good to be squeezed on really hard. And now we got quite a bit of movement. You could even slide underneath the biceps like so, curl directly into brachialis, and treat it that way. It's all just about figuring out what works for this and for you. So there's a ton of different tools. Now, the other thing you can do is you can go the opposite direction. So let's say you've done all of this, or maybe you've done all of the deep stripping from inferior to superior. Come back the other way. Go that opposite direction. Sometimes what I'll do is I will do deep stripping, both open palm, and then isolated with my fingers, do my pincer compression, and then my make nice is gonna be the opposite direction. Just because it changes things up for your clients. You're not doing the same additional thing. Then you can come on back down. And then you can allow that arm to extend. And I usually stop at about 175. Like if you go to 180, that's okay, but what you don't want to do is allow that to just hang, because then that's gonna put compression here into your elbow. Got some nice open palm. And then looking, so we gotta do coracobrachialis, okay. So, all right. If your client can tolerate it, one other thing, you can have them actually perform this active contraction as you squeeze in and then let them relax instead of it all being passive, like so. Then if I squeeze in and just about 10% of your power, just flex your arm. As soon as you feel this fire, that's where you're gonna have them stop and hold and then relax. So that'll be your compression hold that you would do for the same amount of time as you would do if you were gonna do it passive. But then moving on into coracobrachialis, this is where stuff gets fun. So this position is one that you're going to need to get comfortable with if you want to perform a really good pec treatment. This is an acquired taste and it takes a little while to get good at, but you're going to end up doing a lot of internal external rotation with your arm, or excuse me, with their arm by using your elbow and the movements of it, okay? Because you're going to need to bring them up into that 120-degree angle to then lengthen pec minor later, but don't worry about that as much now. For coraco, we're gonna drop it down at 90, 90, and then you can compress in here, feel for that coracoid process, find where it's at, because you know that that's where it's attaching. That's Banks is right there. Now, looking at Banks, I can't see where coracobrachialis is, but I know that it needs to live somewhere right in here, right? Between the anterior deltoid, the most medial portion of the bicep, and then this soft space right here that we don't dig our fingers into. So, because of that, I'm gonna take this hand, turn it over, and then I'm gonna have him perform a little bit of a deduction. So what I tell my client is I want you to take your elbow and just meet my resistance, but go towards your chest, and then you'll see it pop up. And then relax, and then it softens. So scoop underneath, flex, and relax, and you'll feel it right here. You can isolate it that way, okay? And the other thing you need to do is close your eyes and find that pulse. So Banks' pulse is right here on my middle finger. My index finger, I don't feel it at all. So that's the start of the coracobrachialis as far as the width of it. So that is it right there. And it's gonna dive underneath that bicep to right here. So that's about the top one third. Well, I just had felt it with my middle finger in this position.
So then did you move over off of that before you moved your fingers?
Yeah, because that right there is the border.
Okay.
So that's the most
Right, you
lateral
wanna
and
be
medial,
off of the
medial and
pulse
lateral
point.
border. Yeah.
Yes.
So
Okay.
this is still currently on it. This is where the muscle is that you're trying to target. From here to here. Right about there, actually. So to treat this, you're going to use quite a bit of lotion from an NMT perspective. So I'm just gently going to apply this first on this whole area. I'm just going to do even a little bit more than that. Okay. Now to treat, we're not, you can use your thumbs, but you always just need to make sure where that pulse is at. So what I'll do sometimes is with my bottom hand, because I'm going to be working this one, compressing with this one, I'll maintain compression on that pulse just to know where it's at. And then I'll use this hand to strip. And it is not going to take a lot of pressure. And you're going to need to go very slow as you sink into that coracobrachialis. And then now we're hitting the deltoid. So you can do a couple of things here. One, you can continue across the deltoid and work through it and the pec. Number two, you can aid deduct and sink beneath and through. Because see now how the pecs are moving out of the way?
Yeah.
Right into that line. And what ends up happening is you do this movement, you shorten it, and then you can pin into that coracoid process and even allow that arm to relax back down before you come out. This is also going to help us in lifting pec minor and pec major, or excuse me, lifting pec major to get to pec minor later. Or you can go right over top of the anterior deltoid and the pec attachment and work very slowly through them over top of the long head bicep, the deltoid, and the pec to target the coracobrachialis at the coracoid process right there. Okay, so you just have to go very slow when you're treating this one. The other thing you can do, I think I put some, oops, sorry, Banks. Okay, so I don't talk about it, but you can perform contract relax. So you can sink in to that coracoid process, and have them perform. I usually will just like stack my arm this way and then just meet my resistance right there. And we'd hold to treat those trigger points. Friction, 3 slow deep breaths, and then you can gently come on out and relax down. And the other thing I will say, who was I talking to? You, Sunshine. So we teach in here, 3 to 6 deep breaths. If you don't feel any change in that muscle, keep treating it. So hold that trigger point longer. Allow it to, allow them to continue to breathe. You just don't want to hold it for any longer than about like a minute and a half, because then you might stress that tissue out too much. So as you're compressing in, if it's not changing, just slow down, hold, have them keep on breathing really slow. And then what you want to feel is that tissue to soften underneath your fingers, because it will. You just got to be patient for it. But for the frictioning, what we are going to do is we're going to come into the coracoid process first. And you can actually, if I press down, you can see the little bony prominence right there. So this, you got to be really careful to make sure that this feels good. And ideally, we would treat the pecs first and then come back and do all this frictioning at the end. But stay lobby. So I'm going to start. Here's a clavicle. I'm going to traction inferiorly right into that coracoid process. And I'm going to use my other hand, and I'm going to take and perform circular friction all around that entire coracoid process. Just like so. You're going to feel the pec. This upper portion of the pec is a little bit different than the middle fiber, because it's kind of, I like to think of these as pizza slices, like 1, 2, 3. But so you'll feel it kind of roll a little bit. You can even see, boop, pec right there. That's all pec. Okay. So if that rolls underneath your finger, that's okay, but just control it like that right there. You can also perform hooked linear compression. Again, very slow, very firm, very small movement.
If you're doing the hooked linear, is it going to be around the coracoid?
I am, so here's the thumb for the coracoid. Here are the attachments. The first one, I'm going around the whole structure. The linear, I am inferior to those attachments and working to the coracoid and down, yeah. But that's how you're friction that there. You can't really friction underneath directly to that biceps tendon, so we'll hit it indirectly by following, like we did last week, around that acromion. And this also helps get the whole anterior deltoid. So you start out here at the clavicle, slowly friction, pull it up, and a fingernail length at a time to kind of trace. Ooh, there we go. All around. You got the long head right there. All around the actual acromion. And then just work your way all the way to the back, to right about here where you can actually compress and not be, super pronated and throwing away all body mechanics. Now for the lower part, we already showed you how to friction here. For the bicipital aponeurosis, if you take, here is where this median nerve is going to come out. Go down, we've got the lateral epicondyle here, which I can trace. You can feel the canal here for that ulnar nerve. So we want to be in this section right here, okay? So I will flat compress and perform linear friction and cross fiber friction by just performing flexion extension, okay? And just take your time with it. And then at the very end, what we're gonna do is we're gonna come on. Oh, you would do another couple make nice open palm FRI strokes. But then lastly, because we'll be doing this on pec day 2, I'm gonna hook right above the olecranon into the tricep. I'm gonna allow this wrist to rest here on my elbow. And I'm not going to come under here and grip, because this can be uncomfortable for some people. If they have a lot of adipose tissue on the back of their arm, it can be really burning. It can give you a burning sensation. And I'm also not gonna grip right here too much, because we've already stretched. This tissue is probably warm and potentially a little bit sensitive after all that treatment. So hook underneath here. The more skin contact on you, the better, because that will give you something to grip on. Then take your hand, grab the forearm, and we are gently going to traction away. And then once you get to your end point, where as far as you want to go, where you've got appropriate tension, then I'm gently going to decrease the compression in my hands. and just allow his body to naturally go back. So I'm not pulling him out and putting him back. I'm pulling him out and letting his body decide how far back he's got to go. So 90 degrees, 45, I'm going to shift my grip. So I'm going to come up, same place on the grip here, or you can grip down by the elbow, whatever works best for you, depending on how large the forearm is. It can be kind of hard sometimes. With this hand, we're going to compress down into that coracoid process and the glenohumeral joint, and then gently lean back and away.
Okay.
The reason for this is because if I pull too hard here, this will come up. So you want to pin it to make sure that it stays back and down as you pull and lunge away. So that would be your other one. Same thing, gently release your grip, then move the arm down here. And with this one, you can do it a couple different ways. You can traction this whole thing, but what I will usually do is I will compress down, hook into the back of the scapula, because we know down and back is what we need those to do, and then I'll gently lean away. And this will bring that whole structure down, and you can gently come back up, or if you want, you can grip, push down, then lunge and do the whole arm. And then gently relax and let that go back. So it's really just kind of all about what you want to do and how it's working for your client. What questions do you guys have on that? None? Cool.
You want us to do both arms?
No.
Okay, I was gonna say we wouldn't have time.
No. So you guys have, you got a